And the wall of the uterus can be divided into 3 layers. This layer here, which is the endometrium inside. This layer here, which is the myometrium. Myo means muscle, so that's the smooth muscle layer. And then the outer layer is the perimetrium. So if we look at that more close up, what you're going to see is that, again, that the perimetrium is the outer layer, which is not even really shown on this slide because this is the lumen. The myometrium is the smooth muscle layer, and then the endometrium is what we're really going to be talking about because this is what changes across the cycle. So it has a basal layer, which is always there. So let's see if they even have it outlined in here. The basal layer is like the lower layer, the base of the endometrium. And then it has the functional layer. This is the part that will slough off during menstruation. In the functional layer, you have spiral glands and spiral arteries because they look spiraled. So this is the functional layer above. Now this is what happens during the uterine cycle, and you can actually align the uterine cycle to the ovarian cycle and compare what happens during each of them. And you'll see that what happens during the ovarian cycle is very much related to what happens during the uterine cycle, because when you are in the follicular phase, before you've ovulated an egg, when you're just developing the follicles, it doesn't make sense to have a nice plump endometrium because there's not going to be a fertilized egg to implant there. But during the luteal phase, when the egg has been ovulated and possibly been fertilized, it makes sense to build up the functional layer of the endometrium so that an egg, the fertilized egg, can implant. And that's exactly what happens. The uterine cycle, or the menstrual cycle, starts day 1, is the first day of menstruation. And this is when you have low estrogen and progesterone levels because you don't have much follicle development yet. This comes from the follicles, and you don't have many. And this comes from the corpus luteum, and you don't have that either because it's degraded from the last cycle. So you don't have that, and you don't really have that. So low estrogen and progesterone levels. Menstruation can last anywhere from 3 to 7 days, depending on the individual. But during menstruation, what happens is the apical portion of that functional layer sloughs off, and you'll have spiral arteries remaining, but you actually, that's why you actually get bleeding. So this functional layer sloughs off and then comes out through the cervix into the vagina. The next phase of the menstrual cycle is going to be the second half of the follicular phase. So menstruation is days 1 through, we'll say it's a week, even though that's a little long, days 1 through 7. So it's the first half of the follicular phase, if you want to compare the two. Proliferative phase is the second half of the follicular phase in the ovarian cycle. The reason that's important is because now we have high estrogen, and that's because we have developing follicles, and lots of them. And that high estrogen level leads to this proliferative phase, and this is what it looks like. You get a proliferation of the cells in the functional layer so that they start building up again. So you start getting a thicker functional layer. Now, as the estrogen rises, remember that eventually it's going to positively feedback and cause the LH surge, which happens here. And when you have the LH surge, the next thing that you get is a corpus luteum from the remnants of the follicle that was ovulated. And the corpus luteum secretes progesterone, and progesterone is what leads to the secretory phase. It makes the uterine, functional layer of the uterine lining, a really nice place for a fertilized egg to implant. Day 21 is the optimal day for implantation if a woman has a typical 28-day cycle. And that makes sense because ovulation happens on day 14, and it's going to take about 6 days for the fertilized egg to travel through the fallopian tube and get to this nice area of the uterus where it can implant. So day 21 is ideal. If this doesn't happen, then the secretory phase will end with the degradation of this corpus luteum, which will then lead you back to menstruation on day 1. So the whole cycle will start over again.